Now, a joint report by two think tanks says that the number of people who died of coronavirus in the first wave would have been double if white people faced the same risk as black people. Well, the Institute for Public Policy Research and Runnymede have looked at what they say is the unequal impact of Covid-19. Dr. Parth Patel is the lead author of the report and a London A&E doctor. Thank you so much for joining us this afternoon, Dr. Patel. We've been told that the reason for the unequal impact, as you call it, of Covid-19 is because of underlying health conditions within non-white communities. Isn't that an end to the matter?
Hi, Assad. So that's not the case. This new research finds that underlying diseases, things like diabetes, are not driving these disparities. They explain only a fraction of what is a massive risk disparity. What we find is likely to be causing or driving these inequalities are structural differences. Differences in the jobs people do that make them more exposed to the virus. Differences in the conditions in which people live, which mean the virus transmits through households easier, and differences in how people access healthcare.
But that makes it sound more of a class issue then. So surely it doesn't matter whether someone is of an ethnic minority, if they're white, if they're living in overcrowded housing or from a poorer background, aren't they more prone to suffer from Covid-19?
So race and class aren't two mutually exclusive things. There are massive overlap between those two. You're not either black or poor. You can be both. And here in London, we see that more starkly than in the rest of the country. Many people from black and minority ethnic backgrounds live in more deprived conditions. And the solutions for both race and class inequalities in terms of COVID are often the same. Many of the recommendations we make in this paper apply to the entire population. They just disproportionately benefit those from black and minority backgrounds because they still...
And Dr. Patel, let me just come in there and tell you that the government has said to us that the vital steps we've taken, including ensuring that NHS frontline staff like yourself from ethnic minority backgrounds are best protected. They say they've looked into it and they're doing something about it. What would you like them to do?
What doctors and nurses and health and social care staff need is more from the government. What they need the government to do is better support patients. So often when I was working in A&E, a patient would come in and I would have to say to them, look, you probably have the coronavirus, but we haven't got enough space in the hospital. So just go home and isolate and hopefully you'll be okay and make sure you don't do anything for 2 weeks. And often the response I would get would be, okay, doc, that's fine. But if you're telling me not to drive my taxi for the next 2 weeks, how will I pay my bills?
Okay.
We need the government to support patients.
And Dr. Patel, we'll see what happens with that. I'm afraid to have to end the interview there. Thank you for your time this afternoon.
Thanks, Assad.